I decided to chair this commission for two reasons. One is that I really like tackling difficult issues, and this clearly is a difficult and important issue. It matters so much to people. And the other is a much more personal reason, which is that everybody has at some point had to try and deal with the health and social care system in conjunction with a relative, an older relative, sometimes a younger relative, and know how difficult it is for well-educated, articulate people to deal with. And if it's difficult for us, my word, it must be difficult for the population as a whole. There's an obvious reason for establishing it now, and indeed an obvious reason why in many difficult public policy areas people are starting to say, what new thinking do we need? And that's that there's an election in 2 years' time, and we want to try and influence the policies that will come into place after the election. But the other reason in this particular area is that there have been some very useful reforms recently. There's been the Commission on the funding of social care. There's been the establishment of the health and wellbeing boards. But there's a sense that these aren't sufficiently holistic, that people haven't stepped back and looked at the system as a whole. And so that's really what the Commission wants to do. But I think wants to do it certainly without starting off with the presupposition that we need to tear everything up. That's absolutely not where we're starting up from. We do want to look at it as a whole, but equally I think we want to give things that have just been established a chance to work better. I'm always very curious about all kinds of things, and so setting out with this commission, the things I'm really interested in looking into is what is going to drive need? What in sort of 20 years' time do we think people are going to need in terms of health and social care? Are there things we could be doing today that will prevent health problems arising in the future? How are people going to want to handle it between affecting their own care, involving their families in their care, and move away perhaps from the sort of top-down being told by the medical profession what to do? These strike me as big questions, and setting up a system which is going to respond better to where people want to take the system is part of what it's all about. In some sense, in what we're wanting to learn, of course, the big question is what is the challenge? But once you've established the challenge, the very obvious big question is how are you going to meet that challenge? And there are two things here. One is who is going to be entitled to free care or partially funded care, and how you're going to set up a set of principles on which you're going to, make those rather difficult judgments. And then the second big question is, how is it going to be funded? Is it going to be possible to fund the kind of care that we all want out of running the system better, or are we going to have to think more radically? And that's the really big and uncomfortable question. Of course, the big and uncomfortable question that independent commissions are good places to tackle, but have to tackle in the awareness that whatever is said has to be sold not just to politicians, but actually sold to people as a whole. People have to recognise that there's a challenge and a problem, and recognise the reality of the fact that there are limited solutions. When I conducted the previous review on housing, the one thing I learnt was that everybody can identify with the problem, but when you start to set forward solutions, they're always going to be uncomfortable. Sometimes they're uncomfortable because they raise issues about tax and spend. Sometimes they're uncomfortable because they raise issues about asking people to work in a different way. And most of us are kind of, find it slightly awkward to be asked to work in a different way. But one thing that strikes me about this is that when you're dealing with some subjects, there are very clear winners and losers on day one. But for people of my generation and younger, we just don't know when we're old what our health's going to be like, what our needs for social care are. So in some sense, you're setting up a system which you hope when you get old will work out to be fair for you, whether you're healthy or whether you're not. So you're not quite certain whether you're going to be winner or loser, but you want to kind of think it's fair. And in a way, I think that's helpful to this commission, because it means that you haven't got quite such vested interest to deal with in the first place. And I think it's also helpful to politicians, and it's one reason why this, unlike housing, is an area where there's a bit more agreement across political lines about really moving towards a long-term consensus. I find that hugely encouraging. Well, I want to run this commission in a very open way. We're going to have a call for evidence, and I'm sure all the commissioners who I'm looking forward to working with are going to read the call for evidence with a lot of interest, and I hope that we will have a lot of meetings and get to meet stakeholders. So one thing you have to work out is where lines of resistance might be and how you're going to communicate with people who have the potential resistance why this might move things forward. And you can only do that if you've got good evidence and good persuasive arguments, but also if you're prepared to spend time going out and talking to them. But it's not just about professionals, it's also about patients. How do they think it works? How would they like it to work better? Because in the end, in 20 years' time, you look back and say, was this commission a good thing or not? The question you'll have to ask is, do you think that people who are dealing with the health and social care system are getting better outcomes that they are happier with? That's the acid test. Well, I think it's always very easy to say when you're starting off with any difficult question, there's a tendency to say, well, what we need here is a rational debate. And of course, because economists like to be rational, we want to kind of set something up that's terribly rational. But you also have to recognise that this is an issue which is about hearts and minds, and it is about carrying people with you. And to some extent, when we think about our own health and social care and our own families, we're not entirely rational. And so it's actually about dealing with people's needs in an individual way. People will come to the same position with different ideas, and perhaps they have to be responded to more individually.